Egg freezing is really simple and something that you may well regret not doing in the future. So even if you're not quite sure, please do come and have a chat. What does it involve? Well, to start with, we just need to assess your egg reserve. And we've got some more videos around egg reserve testing, but in simple terms, that involves having an ultrasound scan of your ovaries and also a blood hormone level measured to know roughly how many eggs that you have awake at any given time. It's the awake eggs that you've got that we harness to grow during the egg freeze cycle. We call it your antral follicle count, and the hormone we measure is anti-Müllerian hormone. It's all fairly simple and it can be very quick to arrange. We will then arrange for you to have a nurse consultation once you've seen our medical consultant to make sure you know exactly what's involved in the process. And basically, when you come through for the treatment cycle, you don't need to stop working, but you need to be able to allocate about 4 or 5 visits to the clinic over 2 weeks. We will then show you how to take fertility drug injections, and sadly they have to be injections because these are hormones that you can't take as tablets, but they're very easy to do and we show you how to do them. They're just little tiny needles underneath the skin. And you take some daily injections to allow your ovary to grow those small awake eggs. We call them follicles, and they grow from a small size to around sort of 18, 20 millimeters in size, and then we know the egg inside is ripe and ready to be collected. So you come in and have some blood hormone tests as well, so we know the timing is absolutely right, and then you'll come through to have your actual egg collection. When the eggs are ready to be collected, we give you one final injection at a very specific time at night. It's called a trigger injection, and that will allow the eggs to mature and so they can be collected. For the egg collection itself, you will have sedation, so that means you're very relaxed and almost certainly fast asleep and you won't remember anything. The actual process takes between 10 and 20 minutes and is performed by one of our consultant fertility specialists. During the process, we scan you and we place a very tiny needle into each ovary to collect the fluid that is in the small follicles, and that should contain an egg. And your eggs will be passed to our laboratory scientists, and then they can be frozen later that day. You'll then be able to go home, and once these eggs are collected, you'll be then free to go back and start your hormone treatment. Now, what's very important when you're freezing is to make sure we've done the necessary sexual health screening tests on you, because you want to be able to use those eggs in the future. So before you start your treatment cycle, we'll get some very basic tests done in just a blood test for HIV, hepatitis B and C, and we'll potentially also encourage you to have other sexual health screening tests such as chlamydia, gonorrhea and syphilis, and a couple of other blood tests which will allow those eggs to be used in any future fertility scenario. That includes surrogacy. And once those eggs have been frozen, we'll also make sure in 3 months later you have those blood tests repeated again so that they can be assured as being safe to use. We'll also get you to complete some important consent forms, and bear in mind that at the time you freeze your eggs, those consent forms will be in the name that is on your ID documents. Even if at a later stage you plan to change your name, we will be able to come back anyway to change all your consents if you have got a gender recognition certificate. But for the time being, it doesn't matter. We'll get everything frozen in your ID name. We provide lots of support, and we're very experienced here at the Agora with dealing with trans folk, and we totally understand some of the triggers that you may be worried about, and our feedback is excellent. So try to trust us and be confident that you'll be very, very well looked after.